industry is ripe for disruption, but transforming the entire healthcare ecosystem starts with transforming the conversation around it. What challenges and inefficiencies are leading to poor patient outcomes? How will technological innovations influence the evolution of the healthcare ecosystem? What's at stake for patients, payers, providers, and technology partners within this ecosystem? Welcome to Getting After It, transforming the healthcare ecosystem. Join Andro CEO Mike Simmons and Chief Strategy Officer Brett Zelkind as they navigate today's complex healthcare ecosystem by sharing expertise and insight on these issues and more in each episode.
Okay, everybody, we've got Tim Kelley here today with the Andros podcast in healthcare. How you doing, Tim?
Good, Jeff. Thanks for having me.
Yeah, well, it's great to get to know you a little bit. And I thought we'd start out just, how'd you get into healthcare? How'd you start in this crazy business that we're in?
A long time ago, right out of college, working in pharmacy benefit management before anyone had ever heard of that. But that started to grow pretty rapidly, and that company was absorbed by Caremark, and then I went to pharmaceutical rep, eventually brought me to selling equipment for a big distributor that sold radiology equipment, and became very interested in that. And as the digital age started to come of age in the 90s in healthcare, I was brought on board by TDK, the big Japanese conglomerate, to figure out how to sell more CDs and video cassettes and magneto-optical discs into hospitals. And of course, we looked at cardiology first to replace cine film, and then radiology with film, and tried to get all the docs to start going digital with CDs. And so I'm one of the guys that can be blamed for that.
Were you a cassette kid or a CD kid or an LP kid growing up?
All three, all the above.
You span the whole transition from not 8-track though.
8-track when I was a little kid. I remember I had a little 8-track boombox. So yeah.
Was healthcare? Is there a connection with family, friends, community growing up?
Yeah, I had a grandfather who was a doctor, and some relatives that were in the space, and I just found it very intriguing myself. Wanted to be a doctor, but I didn't have the same level of commitment that I have now that I should have had back then towards my career.
Yeah, the academic rigor is quite a lot to commit to. So yeah, some of us, we ended up on the business side of healthcare.
Right.
So when you were looking at getting into this media component, it sounds like you were kind of recording things, activities or images on these different mediums. Was that the standard at the time?
It was slowly becoming the standard. Most as sites were looking to replace film and have a digital format of exchange, they were burning discs and magneto-optical discs, which are like little hard drives at the workstations. So that was a bit cumbersome because you couldn't then put a patient back in the machine because it would pull all the resources to burn a disk. And they weren't that fast at that time. So like an 8X burner might take 15, 20 minutes to burn a disk. We could already have a patient in the system. So we developed a network-based, basically CD printer, and then there was already robotic CD systems out there for marketing, banking, storage of files, shelf storage. And so we just started utilizing those and trying to replace film in sites.
So before you got to what you're doing, what you're working on now, was there like this disruption moment where it became widely known that just wasn't going to be adequate anymore, that these procedures that I remember going in to get my shoulder imaged, and they gave me a folder that had a CD in it, a patient copy of the image. I don't think I had the reader to be able to even look at the darn thing, but I had it physical, and that was going to go travel to my doctor, who was going to load it into some machine. Did that all come to a head? And at some point, and when was that somebody raised their hand and said, this isn't good enough?
You mean the film or the CDs or both?
Well, either. I
Well, there
assume it
was,
was the film was the original, throw it up on
yeah,
on the light thing, right?
right. They used to ship, film everywhere. It's very expensive. Film, just a sheet was getting over $2 a sheet, and then you could, burn a CD for a couple of bucks. And so that was really, it was in a matter of years, it was a pretty quick turnaround that was definitely a needed application for exchange. And then, we thought when we started doing the electronic exchange, it would be much faster than replacing film because you're not dealing with anything that's tangible now. It's completely electronic, which if you look at other mediums out there, whether it's been, marketing, even fax machines have essentially disappeared except for in healthcare. Uh,
Right.
and then if you look at, your consumer laptops and computers that you put in your desktop, none of them have drives anymore. So the last vestige of this is definitely healthcare. And as we say now, it's become the exotic media of healthcare.
Yeah.
And you can't use them for anything else. We get people calling and saying, hey, I popped it into a DVD player and it didn't play my images. And so there's even that misunderstanding now. And people don't have DVD players anymore. Those have faded out. And so, yeah,
Yeah.
it's been a process, and a lot of it is just fear of the cloud. But like most technologies, when they push into professional areas like healthcare, it's because it's much more consumer driven. So as those employees are more comfortable using the cloud for all different things, whether it's sharing photos and other bits of data they have, then they're going to stay, pushed to their bosses and for their own use, saying, hey, we can use this for moving images and patient data. And it's more secure than a CD, and it's faster, more reliable. So it's definitely the path forward.
So on the security side, how much did privacy hold up? The word privacy hold up the progress? I guess that's often something I hear in healthcare or see in healthcare is we don't have the privacy guardrails to do that. So we're going to stick with the fax machine, or we're going to stick with the whatever legacy product. I assume that affected this industry as well.
Yeah, and it's a really strange thing because you just mentioned fax machines, and they're still considered HIPAA compliant, but yet it's open data sitting, just wherever that fax machine is at. And
Right.
then these encrypted ones didn't really work because then you needed something on that computer to decrypt it. And of course, nobody likes other programs running to decrypt something when all the fear of the malware and so forth and ransomware out there.
Right.
So yeah, it really comes down to a misunderstanding of what is privacy, what is compliance, what does real security actually mean. And that's one of the things that we do on a mission every day is try to explain that to customers. They many times will have a HIPAA compliance officer or somebody in that capacity. And even though that's their job, they're missing many of the components of what it means to be private and why this is more secure than using the tangible formats. And we can lower their liability and even indemnify them, which we can't do with the CDs, of course.
Right. What's the so go to maybe just an introduction of what the company is that you're working on now. TeleRay is your latest venture. Give us a little quick snapshot of what that organization is about.
Sure. Thanks. So TeleRay is a SaaS platform that is based on moving data. So all patient data oriented around the primary diagnostic tool, which is radiology. So we first center on moving the imaging data and then attaching any other data we're allowed to with that image set so you can get a more holistic view of the patient. So that will include, of course, the radiology reports, labs, cytology, pathology, even financial data if they allow us to grab it and add it. And in addition to that, we've extended the tentacles a little bit further. We can do live streaming of modalities. So basically place doctors or professionals virtually into rooms so they could guide a technologist or sonographer. So for rural health, trauma situations, emergency medicine situations, with the lack of doctors and specialists on a global level, the only way to solve some of these problems is through technology and being virtual, just like we are now in this meeting, is going to be one
Yeah.
of those problems.
Yeah. Oh, that's great. So let me say it back to you. Just one is the payload of information, with the image at its core, and then all the context around it, files, notes, interpretations, financial reports, as a package, a secure package of information that can get transported to the place that needs it.
Right.
And then the second part is, and probably the word secure pops up again in your conversations, the secure communications, and really a channel for an expert to virtually be in the room while a procedure is happening, and guide somebody who's maybe got a lower, doesn't have quite the expertise that the outsider does, so they can collaborate together to perform a procedure or interpret something. Am I getting that right?
Yeah, you're exactly right. That's what we're trying to solve there, including, let's say we're on Zoom right now. If you were my doctor, and if Zoom had some of these capabilities, you could bring my images or labs right up on the screen and give that visual, and still, while talking face to face, have a consultation, say, okay, this is where you have a broken bone, or if you're an oncologist and your disease state, this is where you're progressing and beating this, or whatever the situation may be. It's a much more meaningful conversation if you can also have those visuals, just like in the prior days, the doctor slapping your images up in the light box so we could show you what was going on.
Yeah. Are there places in the healthcare ecosystem that are more ripe for this kind of technology? Is orthopedics, for example, is that a little bit easier lift with how they're getting paid and the risks that they can take in bundled procedures, that they more apt to support something like this? Or is it more critical care solutions that need real-time expertise, or both?
It's basically, because we're focused on imaging first, it's anyone that is doing imaging, and that keeps expanding. So if you look at the 700,000 doctors' offices in the US, 500,000 of them have some type of imaging device, if not more than one. And so imaging is very predominant in most practices, that, hey, let's take a look inside to see what's going on. If you look at what's currently going on, even stethoscopes are disappearing, and in place for point of care ultrasounds that pick up Doppler and a view of fluid in the lungs or whatever else may be going on. And with that, you have these doctors and specialists starting to do all their own reads because there's not enough radiologists. So more orthopedics, gastroenterologists, podiatrists, based on their specialty, are becoming better at reading the films. And if they see something that may be more of an issue, they'll send it off to a specialist radiologist. But many times they're doing their own reads, their own reports, and keeping that in-house, which does, if they're efficient at it, will also increase their billing. And also, in many cases, faster speed to care for the patient because it's on site. We see what's wrong, we're going to fix it right now.
What's the feedback amongst the insurance payers, Ben?
Geez, that's a varied thing depending on who it is.
Yeah.
There's what we call healthcare's dirty little secret. So there's a lot of rescans that go on radiology. Radiology surpassed pharmaceuticals in 2014 as the most expensive facet of healthcare. Most people can't even believe that or comprehend that.
No, I can't. I didn't know that.
Yeah, they want to keep these MRIs and CT machines running. And so many times if the data being moved, and this is often on CD, if those images can't be restored, the patient is just sent in for a rescan. And so that adds billions of dollars to healthcare, slows down speed to care, costs, and at the end of the day, you are a consumer in this space. You're paying a lot more for the same service.
Right.
I mean, you wouldn't go and get your oil changed twice in 3 days. But in radiology, it happens constantly. And if you look at radiation, then, and that was CT machine, CT is responsible for about 2% of cancers in the US.
Wow.
So, that's a big problem.
Yeah, it's beyond waste. It's actually a health risk. For the folks that are around those machines. either receiving the treatment or administering the treatment. I assume that they have a byproduct of some of that radiation as well.
Sure, it's a big issue, and it's just kind of swept under the rug. And we try to expose it based on the fact that when we move data, it has to be 100% usable in a universal format. Because it's one thing to move something from A to B, but if you can't use it, you've achieved nothing. And, so that's a big part of our focus, is try to eliminate that without getting the payers upset or the providers upset, just saying, hey, we just do it the right way.
Do the the expert opinions, the radiologists that are, I think a lot of them are working from their home now. Are they the chief supporters of technology like this, so that in your rural case, if they're working with if they have a contract to do some consulting or remote work with a rural hospital, they prescribe it and say, listen, there's a better way to do this. If you use this technology at your facility, our collective results are going to be better.
Yeah, I mean, we definitely have a lot of those as our advocates, and generally it's because of the money element of it. If they're reading a duplicate scan, they may not get reimbursed for it. They've done the work, because they say, well, that's for the same patient for the same reason. They're scanned twice, and they want to make sure they collect the reimbursements, because they're getting squeezed all the time on what they're going to get paid from the payers for that.
I got to believe that not all parts of the globe are created equal in this area of work. Are you looking beyond the borders of, there's plenty of social determinants of health problems or issues within our US-based healthcare system, but it gets really big in some parts of the world.
Yeah, it's a definitely a global issue. Again, lack of specialists and so forth. But what's really great in some of these countries where if you look at the socioeconomic strata, they can't pay as much, and there's not as much access, where these technologies can solve both of those problems, and they have the opportunity to leap the curve with 5G phones and not needing some of these networks that the US is dependent on.
What are you guys doing to support some of those tough to reach areas? I'm sure there's some experimenting, but also some giving that you're doing for the greater good.
Yeah, we definitely will discount to help out in areas, and we have a humanitarian side of the business where we look at just providing those services in certain situations, certainly in any type of emergency situations. And patients are always free on our platform, so any patient can create an account, upload their data, and then have it at their fingertips on their phone, their iPad, wherever they are in the world.
What do you think? How do you think this evolves in the next 5 to 10 years? Is this, it was hard to predict all those mediums that we had when we were kids, going from one to the next, and each one was more novel than the next. What do you see? What do you see around the corner, especially around maybe AI coming into play?
Yeah, I think AI is going to be the biggest factor in this. So a lot of AI sits on an island. It's not usable unless there's something to enable it. So we have a bunch of AI partners where we enable their capabilities, and there's still some resistance to that. But in other parts of the world, resistance can't even be an option, because there's no one to read it except the AI. So whether it's fast musculoskeletal read, heart read, where it does automatic ventricle measurements to say, you can just give him Lasix, or he needs to go into surgery immediately. There's all these variables that can basically triage a patient and where they need to go. And that applies from rural health to the out in the bush to just where there's a lack of any supported help to make a clinical decision. And there's some AI coming out that we've looked at some of these shows, where basically from the camera on your phone, they can read your face and tell you your blood pressure and some other markers to give them indicators of different disease states. And those things are remarkable. Eventually you'll be able to breathe into your phone, and it'll read biomarkers from your breath to give a lab report. So that in the next 5 to 10 years, and the speed at which it's coming, is I think it's fantastic.
Yeah. Wow. How do the clinicians feel about all of that? Are they excited because their work becomes more scalable and they're kind of practicing at a higher level of their licensure? Or are they nervous that is this job that I'm doing going to be less and less important or more obsolete?
Yeah, it's a kind of a binary situation because they're overworked and overstressed right now. So, but also afraid of these AI tools. At the same time, when they start to realize it relieves a lot of that pressure, ultimately, my belief is it'll make their job, they'll be better at their job.
Yeah.
So at the same time, the technology is advancing fast on the modality. So now you have a CT machine that's doing 4,000 slices, and there's no radiologist that's reading all those. So you have to have something that points out these are the key images for you to look at. And that could be true of even listening to a Doppler saying, okay, look at this segment here, not the entire study. So at that point, they can become much better at their job by looking at the critical data and not wasting time with the non-critical data. And I think you're going to see then better outcomes for patients too.
Yeah, makes sense. That's a win all around. Do I'm kind of looking at through the lens that we live over at Andros every day is around credentialing and network development. And, one of the things that has been a challenge, I guess, or maybe a boom in the market is practicing without borders. So if I can, how can I practice in 50 states tomorrow versus 10 years ago, I'd be maybe licensed in 1 or 2 states or 3 states. Are you seeing that as well with how this technology is supporting virtual care?
I think there needs to be more done with that. I mean, you look at, lawyers, I think if you have the Illinois bar and the Florida bar, that covers 47 states, something like that.
Yeah,
And that should be the same in healthcare because just like with the law, how many variables are there? There may be some, coding issues and things like that with certain states, but overall, it's so close that I
right.
think you have to be, from the credentialing standpoint. And there's some other issues with credentialing, as you know, but
Yeah, yeah. It's like everything in healthcare, we see opportunity to improve it and make the picture of a clinical provider clear every day versus only clear once a year or every other year when they renew something. So we're struggling and kind of scratching our head, and I think there's general agreement with you that the similarities outweigh the differences from the state to state or practice to practice standpoint. But we're not there yet. We're not there yet. I'm glad. Actually, it's good that there's companies like you that are kind of pushing that envelope because the demand to get credentialed staff without borders, working with different facility organizations or provider groups or even payer groups. I think it's good for everybody.
Well, it's interesting that you look at the equipment and then even the pharmaceuticals that can be, of course, sold in every state, which end up being pretty much status quo then for their use. But a technologist can travel from state to state using that license.
Yeah.
Because they're accredited by a national accreditation company, not by the state. And that's there could be something like that for doctors where there's a benchmark, and if you hit that, then you're credentialed in all 50, and that would be, I think, a good route to go.
Yeah. Well, final thoughts on how you think this business is imaging, this expertise over the airwaves or expertise over the it's a combination of, I suppose, airwaves and wires. How's that going to shake out over the next 12 months?
I think there's a lot that's going to stay the same that shouldn't, and a lot that should change. It'll start moving. We're looking forward to that tipping point where, these sites say we've had enough of CDs, they're just coasters now. We're not buying another one. And that'll help push that move towards data because as mentioned before, being that radiology is the primary diagnostic tool, everything should be built around that. And that's how data should be moved. And I think one way to help drive it is we have patients start demanding it. because they forget that they have rights and they're consumers. They're paying a lot of money out of pocket, which makes you a consumer. And if we were in a restaurant or somewhere else and we were treated the same way, we'd say, absolutely not. I'm not.
Won't stand for it.
Yeah, I won't ever eat here again. And yet we put up with it, and it's ridiculous. So I think we have to act more like consumers in this space.
Yeah, agreed. Well, Tim, thank you for spending time today. This has been a great education for me and kind of opens my eyes to what I now know is bigger than pharmaceuticals as far as spend goes. And now I know somebody who's in the center of trying to make a change for the better. Really appreciate it.
Well, thanks, Jeff. Thanks for having me. And hopefully we can work together sometime soon.
That sounds great.
You've just listened to another episode of Getting After It. If you enjoyed today's show, don't forget to like and share to spread the word. Subscribe to catch future episodes and visit andros.co/podcast for more. Check back next week for more information on what's happening in healthcare and how we can create a better healthcare ecosystem that provides better care for all.